A center at the University of Tennessee Health Science Center has worked to provide services to young people with mental health and trauma-related needs. The Center for Youth Advocacy and Well-Being helps those who are at risk of entering the justice or child welfare systems. And joining us today is Dr. Alicia Barnes. We're delighted to welcome you, a child and adult psychiatrist, Urban Child Institute Endowed Chair of Excellence for Child and Adolescent Psychiatry. You are super well qualified to hold this post. You told me about all your degrees in the green room today, and Dr. Alta Stewart is the one who recruited you to this position.
Yes, she absolutely. I'm a new Memphian, but Dr. Alta Stewart I knew from when I was a medical student, and she had an opening for an associate director for the Center for Youth Advocacy and Well-Being, just to continue this work forward. And I started my career as an academic and continuing at University of Tennessee Health Science Center, really bridging the community work that she does and has been doing for now 10 years with the data so that we can implement that nationwide and really see positive impacts for the youth in our community.
So it's a national model you're trying to create here.
That's right.
So for 10 years, a decade, you've been trying to help Memphis youth at this center. This center has been at the work. You're new to it here. Yes. And so tell us about the center and the reason behind the work it does.
So the center was actually founded 10 years ago by Dr. Alta Stewart, who is the first African-American president of the American Psychiatric Association and a native Memphian from South Memphis.
Indeed.
So when the work that she's done there, working with the justice system, as well as putting on trauma summit, engaging the community, families as well as children in our community to move upstream and the needs that children have, has been what drew me here, but also it continues to go on. We have programs this past year working with different partners at faith-based organizations, after-school programs, people that are located in the zip codes where children live on a daily basis, and building those programs in alignment.
Can we talk specifically about what you do? Because clearly Dr. Stewart used all her persuasive powers to get you to come here and take this job. And so there was something deep in her pitch that you saw the need for your services and the need for the research that you're doing to be done. And so tell us really, what was the straw that broke the camel's back that said, yeah, I want to be in Memphis to do this work?
Well, there's no one like Dr. Stewart, first of all. If you met her, you know that. But also, there's nothing like this work. The staff at the center are all dedicated in the community on a daily basis, committed to the work of treating and working with children, not even treating, but answering and working alongside and guiding children and their families in Memphis.
Right, and a lot of these kids are kids who are possibly about to enter the juvenile justice system, and they're coming through and visiting with you, and you're having the opportunity to say, what's going on with you? What's happening in your family and in your life that has led you to this situation, right?
That's exactly right. So we actually had a summit, not a summit, but the conference today where we talked about, we had Commissioner Caswell there, and if you've met him, you know it's not what's wrong with you, but what has happened to you. So a lot of times we're sitting, we're talking and working with youth to see what's happened in their lives. What is it like to wake up in their homes and go to their schools?
Yeah, and you know, in a lot of the schools, I get to go to some of the schools, and a lot of them are very regimented. It's almost like I don't want to say like a jail atmosphere, but some of the security staff is pretty strict, and you know, it's a thing that might affect a child, you know, beyond the schoolyard. All right, the center is designed the first youth reentry program for Shelby County. How has that helped change the futures for some young people?
Yeah, so it really meets a gap that we have when children are returning to community as they're outside of their community in a carceral system, they have to return home. They have to return to a school. They're a return family member, and really bridging that gap for them to re-enter into the community and decrease the recidivism or the risk of reoffending is so important. If we don't have that gap met, we risk losing out on the future and the development of that child. And we know children's brains don't completely develop until 25.
Yeah.
So there's a lot to
And there's some late bloomers
develop.
like me who take a little longer than that. So, so you also work with colleges, the University of Memphis and Lemoyne Owen, and you have some relationships there, right?
Yes. Well, we have collaborations. We're open to collaborate with anyone who wants to help work with mental health and work with children and their families where they are. But with the University of Memphis, we actually have a grant that's training the next generation, occupational therapy, social workers, psychologists, to have a trauma-informed lens of care.
All right, and finally today you hosted a summit called the Psychiatric Advocacy Collaborative Teams Summit that had Commissioner Caswell as part of the players in that.
He came. It was a great event. He came, but we had Dr. Alpha Stewart was on the panel, led the panel, and also talked about the last 10 years that we've had of work at the Center for Youth Advocacy and Wellbeing. But we also had the president of the American Academy of Child and Adolescent Psychiatry, all the way from Philadelphia at Children's Hospital of Philadelphia come, as well as Dr. Russell Leday, who came and spoke about his work in the carceral system, really having a program that touches base and reaches the young boys that are there.
Well, Dr. Alicia Barnes, a new Memphian, but
Yes.
one who is making an impact in our city, and she has twins, she told me, a boy and a girl, 10 years old. Congratulations on that. And thank you for the work you're doing to try to help our young people find their way and have a healthy mental outlook.
Thank you.
All right, it's great to have you here. All right, we have some weather in town today, so let's listen in on that. Ron Childers?